morning. Welcome back to Open Med School and Dr. Andrews, Professor of Medicine, Consultant Neurologist. Today I am going to discuss with you another concept in pharmacodynamics, the dose response curve. We know that when you take a drug, it gets absorbed, it goes to the tissues, it acts on receptors, and it produces a response. The response can be a therapeutic response, it can be a side effect, or it is a toxic effect. There is always a relation between the dose and the response. As you increase the dose to a particular level, the effect increases. So this response, when you plot as a graph, that is called the dose response curve. Let us look into the dose response curve. So objectives of today's discussion is understand the dose response curve, define Emax, ED50, efficacy and potency, and apply these concepts in clinical situations and solve some MCQs. That is our target. So what is the dose response relationship? I already mentioned plotting the logarithm of drug dose against drug response produces a sigmoidal dose response curve. So for example, on the y-axis it is a response and on the x-axis it is the dose. Dose in log. Here it is the response. This produces typically a sigmoidal curve and this is the dose response curve. Suppose we are plotting instead of the log the actual dose. Let us see what will happen. So again this is the x-axis. In the x-axis one tablet or a dose is given, it produces a response. When you double the dose, the response increases. When you again increase, again further the response increases, again you increase, the action increases. And when you plot the graph will have a shape like this. It is a hyperbola or a linear response system. So this is the dose response curve, this is the log dose response curve, and this is usually taken as the dose response relationship for calculating. Let us look why we are plotting it as a log. It produces a sigmoidal curve, it shows the therapeutic range. These are the purposes of this dose response curve. So this maximum effect that is obtained is called the Emax, and this indicates the efficiency of the drug. So efficiency of the drug is determined by the response it produces. So that's one term, efficiency. And why are you using the log dose? Because it compresses wide range of doses and makes the curve more symmetrical. So if you are using the hyperbola, what happens? This type of graph, a large graph is required, and the initial part, the curve will be compressed, and last dose increases, it becomes widened, and a wide therapeutic range cannot be shown properly. Hope it is clear to you. Now we'll little more look into the curve. The curve has got certain phases. The initial phase, there is no effect at all. For example, if you are giving paracetamol for pain, if the dose is too small, it will not produce any response. Then as the dose increases, there is a sharp increase in the response. And then finally, even if you increase the further dose, there is not much effect. So that is the plateau phase. So the dose response curve, as I already mentioned, the response suddenly increases and then it reaches a plateau, then further increase in dose will not produce effect. What is the reason for that? As we already mentioned, the drugs are acting on certain receptors. When the receptors are fully saturated, it will not produce much effect. So from this graph, you can identify the threshold dose. So what is the dose at which the drugs start acting? What is the minimum dose that is effective, and the maximum dose for the efficacy, and what is the dosage of drug that produces 50% of the effect. This dose is called the ED50. That is the dose that produces 50% of the response. That is called the ED50. So we'll repeat the terms. One is Emax. Emax indicates the efficiency. So here you can see this is fentanyl producing an effect, and this is morphine, almost similar effect. So you can say their efficacy is same because Emax achieved is same. So now look at the ED50. For the ED that is for fentanyl, the dose required to produce 50% of the response is only 0.1 milligram. For us, for morphine, it is 10 milligram. So 10 milligram of morphine is equal to 0.1 milligram of fentanyl. So which drug is more potent? Definitely the drug that produces the ED50 with the lower dose is the more potent drug. So potency is determined by you can determine by using the ED50. And look at the graph. The graph is towards the left. Such a drug is more potent. Don't confuse it with the efficacy. Efficiency is the response. Emax determines the efficiency. Hope these 2 points are clear. Efficiency is the maximum response, and the potency is the dose. Smaller the ED50 or the smaller the dose required to produce the desired effect, it is a more potent drug. The graph is towards the left side, it is more potent drug. Hope it is clear. So I repeat once more. Potency is determined by identified by looking at the ED50. What is ED50? It is the dose producing 50% of the Emax. Emax is the maximum response. Lower the ED50, the drug is more potent, but not equal efficiency. Does not equal to the efficiency. Efficiency is the Emax. Now we think about another important terminology, the therapeutic index. So we are giving the medicine 50% efficacy, that dose is the ED50. Suppose you give the drug, 100% of the people develop a toxic effect, and the dose producing 50% of the people developing toxicity, it is called the toxic dose, ED50 toxic. In animal experiments, sometimes it is called a LD50. That is the 50% of the animals develops death. That is the LD50. LD50 or ED toxic divided by ED50 therapeutic is the therapeutic index. For example, the ED50 for toxic effect is 100 milligrams, and the ED50 is 2 milligrams therapeutic. That is so the therapeutic index will be 100 by 2 is equal to 50. So this is a high therapeutic index. Another drug, the LD50 for the ED toxic is again 100, and the ED50 is 50, the what will be the therapeutic index? TA will be is 100 by 50 is equal to 2. Just got a narrow therapeutic index. A drug with a narrow therapeutic index needs more monitoring. So the therapeutic margin is low. So this point is clear. That is, a drug with a narrow therapeutic index needs more monitoring, and it has got a narrow safety margin also. Now we'll look into the efficacy of multiple drugs. So the graph can be plotted on and compare various drugs. As already mentioned, efficacy is the maximum response a drug can produce. So this is the maximum response. This is the Emax. So this is depending upon the drug receptor interaction. So when the receptors are fully saturated, you get the maximum effect. So here we can see three drugs, A, B and C. You can see the Emax is different for the various drugs. So here this is the Emax. It's the Emax. So what does it mean? Drug A is more efficient. Now look at the ED50. ED50 of these three drugs is almost same. So what is the inference? So these drugs, even though ED50, that is the dose required to produce 50% of the maximum effect of that drug, is same, their efficiency is different. Of this point is clear. So here again you can see there is three drugs, actually four drugs. So this hydromorphine, morphine and codeine, Emax is same. So maximum response is same, so all the drugs are having same efficacy. Now look at the ED50. ED50 for hydromorphine is lower than that of morphine. So 1 milligram of hydromorphine is equal to 10 milligram of morphine. So which drug is potent? Definitely hydromorphine. So lower the ED50 for the Emax, more the potency of the drug. So whereas take the codeine requires 100 milligrams to produce the effect of 10 milligram of morphine. So codeine is less potent, even though efficiency is same. Hope this explanation is clear. So here look at the aspirin. Aspirin produces an analgesia. It is lesser than that of the codeine and morphine. So aspirin is less efficient. Hope this point is clear to you. Now we take a clinical examples. Let us take digoxin. Digoxin produces toxicity with small doses. What is the reason? Digoxin has got a narrow therapeutic range. That is the importance of knowing the therapeutic range. So here were two drugs. One drug produces this is the sigmoid curve with it very slow rising. Another drug, you can see there is a steep rise in the dose response curve. So drug A is more steeper than drug B. So what does it mean? A smaller increase in the dose produces a sharp rise and it reaches the Emax also. So such drugs have got a narrow margin of safety. Here the drug has got a very slow rise and it has got a wider safety margin. So that by looking into the sigmoid shaped curve, we can identify the safety margin of the drug. So here you can see this is the ED50 of the drug B, and ED50 for the drug A is coming here. And the action of the drug B just got a wider therapeutic range. So this is, here comes the concept of the therapeutic window. So this is the region the drug acts. Increasing the dose will produce the efficacy, and this part is called the therapeutic window. And you are thinking about the toxicity. This is the ED50 for toxicity or the LD50. LD50 divided by ED50 is the therapeutic index. Lower the therapeutic index, the margin of safety will be less. So remember what is efficiency, what is potency, what is ED50, what is LD50, the therapeutic window and the therapeutic index. Now we go to practice these concepts. A drug produces 60% of the maximal response when all receptors are occupied. This property best describes efficacy. So remember the graph. This is a maximum response. A drug is producing only 60%. The curve will be like this. So Emax is less. So it is a less efficient. So efficacy refers to the maximum effect achievable, not how much dose is required. Now we go to the assertion reason type MCQ. Partial agonists reduce effect of full agonists. They have lower efficiency. What about the responses? Answer is correct. Partial agonists occupy receptors but produce less response. So potency is, what is potency? Potency is the dose required to produce a given effect. Measured as ED50 or EC50 dose. D stands for dose, C for concentration, producing 50% of the Emax. So this is the Emax. So curve is shifted towards the left means it is more potent. Shifted towards the right it may be less potent. So potency reflects how much drug is needed, not how good the drug is. More potent drug is not necessarily more efficacious. So efficiency and potency are different. Potency is the dose required for getting the maximum effect. So second MCQ, more potent drugs are always preferred clinically. They require lower dose. The second statement is correct, they require lower dose, but more potent drugs are not always preferred clinically. Potency is the dose for maximum response. So remember the curve. So if you have a drug has, so this is the one drug, drug A. So this is the Emax for the drug. Potency is the dose 50%, that is the depends on the ED50. Another drug, take another example, another drug. The Emax is more, so this drug is more efficient. So we prefer a drug which is more efficient. So the answer, potency does not indicate safety or efficacy. Two drugs have identical Emax but different ED50. Drug A has a lower ED50. So drug is, so we'll draw the graph. So there are two drugs, identical Emax. Another drug, so this ED50 for this drug is, drug A has got a lower ED50. So what is the inference? The drug is more potent. So lower ED50 means less dose is required to produce the same effect. So potency implicates the dosage required to produce the effect. Now we go to the therapeutic index. Already mentioned, ED50 toxic versus divided by ED50 therapeutic. High therapeutic index, drug is safe, example penicillin. Low therapeutic index, narrow therapeutic window, digoxin and lithium. Therapeutic index indicates the safety margin available to the prescriber. So higher the therapeutic index, safer the drug. Let us take a clinical case. The patient on digoxin develops nausea and arrhythmias with a small increase in dose. Which property explains this? Of course, it is the narrow therapeutic range. So digoxin has got a narrow therapeutic range, so it needs more accurate dose modification, and a minor change can produce a toxicity. So it is got a narrow, this explains the narrow therapeutic index. Adverse effects versus toxic effects. Side effects occur within the therapeutic range of the drug. Toxic effects occurs above the therapeutic range. So that's the difference between side effect. I already mentioned, when you are giving a medicine, it gets absorbed, it reaches the cell, it produces a response, which can be therapeutic response, toxic response, or it may be a side effect. These are the responses that you get. Then the concept of full agonist, partial agonist and antagonist. A partial agonist will lower the response of a full agonist. A partial agonist will lower the response of a full agonist. It will act as a functional antagonist. For example, this is the cell and it has got a receptor. A partial agonist can block the receptor and it will act as a functional antagonist. Even though it is functional, it is not fully functional. A patient on heroin receives buprenorphine, develops withdrawal symptoms. Mechanism: buprenorphine act displaces the full agonist. So this is the receptor for it, and the buprenorphine try to replace the heroin. Heroin has got a more potent drug which replaces heroin, so it will act as a functional antagonist and the patient can develop a withdrawal symptom. So buprenorphine can precipitate withdrawal in opioid dependent patients. What's the reason? It is not an antagonist, it has got no high efficiency, it has got a lower efficacy than heroin. So lower efficient drugs act on the receptors and replaces heroin and act as a functional antagonist. Drug targets and dose response. In the next session, we will discuss mechanism of action of drugs on various receptors. So today we have discussed about the dose response curve, the usefulness, efficacy, Emax, Potency, ED50, LD50, and analyze certain few cases. Stay tuned. Thank you.